Think back to the last time an elderly parent or grandparent had what seemed like a mild cold. A little coughing, some tiredness, maybe a slight runny nose. You waited a few days expecting improvement. But instead they seemed quieter, less hungry, a little confused. And yet their temperature felt almost normal. So you assumed they just needed rest. Then suddenly they could not breathe properly. And you were rushing to the emergency room. That is exactly how elderly pneumonia works. And those few days in between, the ones that felt harmless, are often the difference between full recovery and a life-threatening crisis. In South Korea, approximately 80 people die from pneumonia every single day. 9 out of 10 of those deaths occur in people aged 65 and older. Pneumonia is now among the top 3 causes of death nationally. And for older adults, it can be more immediately deadly than cancer. When pneumonia progresses to its severe form, mortality rates range from 35 to 50%, even with treatment in hospital. The most dangerous thing about pneumonia in older adults is that it rarely looks like pneumonia at first. No dramatic high fever, no intense coughing fit, no obvious chest pain. It disguises itself as fatigue, poor appetite, or what the family assumes is just a rough cold. All the while, the infection is spreading silently through the lungs. Today I will walk you through the 5 warning signs that signal a cold is turning into something life-threatening in an older adult. Knowing these signs in advance can save a life. I will also explain why elderly lungs are so vulnerable, what to do in an emergency, and how to prevent this from happening in the first place. First, understand why a simple cold can become pneumonia so quickly in older adults. Healthy lungs defend themselves through 2 main systems. A strong immune response attacks bacteria and viruses before they reach the deep lung tissue, and an active cough reflex clears out anything that enters the airway. In younger adults, both systems work powerfully together. After age 65, immune cell counts and activity drop dramatically. The tiny hair-like structures lining the airways that sweep bacteria outward slow down with age. The cough reflex weakens, and most older adults carry one or more underlying conditions, such as high blood pressure, diabetes, heart failure, or chronic lung disease, all of which further compromise the lungs' defenses. When a cold virus damages the airway lining, it opens the door for bacteria to move deeper into the lungs and trigger a full infection. Now here are the 5 warning signs that every family member needs to know. The first warning sign is sudden, dramatic drop in energy with little or no fever. Most people expect pneumonia to come with a high temperature, but in elderly patients, fever is often absent or minimal. Even when significant lung infection is already present, the body's temperature regulation declines with age, and a weakened immune system cannot generate the strong fever response seen in younger patients. Clinical reports confirm that a significant portion of elderly pneumonia patients present with normal or only slightly elevated temperatures on hospital admission. Some even develop below normal body temperature, which is actually a sign of particularly severe illness. When an older adult becomes significantly weaker than usual, wants to stay in bed all day, and shows no interest in normal activities, do not dismiss this as tiredness. Look for the other signs together. The second warning sign is sudden loss of appetite and dramatically reduced fluid intake. When an older adult abruptly stops eating or drinking, this is not simply a bad day for appetite. Spreading lung infection suppresses the appetite center through systemic inflammation. Even mild breathlessness makes swallowing more effortful, reducing both food and fluid intake naturally. The danger is that reduced fluid intake quickly leads to dehydration, which thickens mucus in the airways, impairs kidney function, increases blood clot risk, and makes the infection harder to fight. If an older adult has eaten very little for 3 or more consecutive days, or if you notice their urine output has dropped noticeably, suspect both dehydration and pneumonia developing together. The third warning sign is sudden confusion or unusual mental changes. This may be the most misunderstood sign of all. When a normally sharp older adult becomes suddenly vague, repeats questions they just asked, cannot recall the day or where they are, seems unusually drowsy, or stares blankly. Families often assume rapid onset dementia or plain fatigue. But sudden confusion is a classic presentation of elderly pneumonia. As oxygen levels in the blood begin falling due to impaired lung function, the brain, which is highly sensitive to oxygen changes, reacts first. In older adults who already have mild cognitive changes, or small vessel brain disease, even modest drops in blood oxygen can trigger disorientation, delirium, and behavioral changes that look nothing like respiratory illness. Reports from clinical settings confirm that, in a significant proportion of elderly pneumonia cases, sudden confusion and reduced mobility were the only early symptoms, with no cough or fever present at all. Any sudden, unexplained mental change in an older adult demands medical evaluation that same day. The fourth warning sign is faster breathing or a noticeably shallow breathing pattern. Sit quietly with the older adult and count their breaths for 1 full minute. Normal resting breathing is between 12 and 20 breaths per minute. If the rate exceeds 25 breaths per minute, and especially if it approaches 30 or above, the lungs are struggling to maintain adequate oxygen delivery. The challenge is that neither the older adult nor the family tends to notice this increase. The body adapts gradually, and the person may simply feel slightly short of breath, without recognizing how abnormal their breathing has become. If you have a pulse oximeter at home, use it. Normal blood oxygen saturation is 95% or above. A reading of 94% or lower warrants a doctor visit today. A reading below 90% is a medical emergency requiring immediate emergency services. Pulse oximeters are inexpensive and widely available at pharmacies. Every household caring for an elderly person should keep one on hand. The fifth warning sign is frequent choking during meals and a wet or gurgling voice after eating. This is the signature warning sign of aspiration pneumonia, a form particularly common in older adults. Aspiration pneumonia develops when food, saliva, or stomach contents enter the airway instead of the esophagus, causing bacterial infection deep in the lung tissue. Swallowing function declines significantly with age. Research shows that approximately 1 in 3 older adults has some degree of swallowing difficulty. The weakened swallow reflex allows small amounts of food or liquid to slip into the airway. Normally, a strong cough would clear this out, but with an aging cough reflex, the material reaches the lungs without being expelled. Even more alarming is the condition known as silent aspiration, where food or saliva enters the airway without triggering any cough at all. The person and their family have no idea. This is happening repeatedly until pneumonia is already well established. If you notice an older adult's voice sounds wet or gravelly after meals, or if they cough frequently during drinking even water, these are signals that swallowing function needs immediate attention. When any of these 5 signs appear, here is how to respond. Call emergency services immediately. If breathing is labored enough to prevent speech, if lips or fingernails develop a blue or purple tint, if the person loses consciousness or cannot be roused, if oxygen saturation falls below 90%, or if confusion becomes severe enough to create safety risks. Tell the dispatcher that an elderly person is having difficulty breathing, and pneumonia is suspected. If the person is coughing or vomiting, turn them onto their side to protect the airway. Bring a list of all current medications to the hospital. For non-emergency situations, if any of the 5 warning signs are present, schedule a same-day medical visit. Do not wait until tomorrow. In elderly pneumonia, 1 day of delay can mean the difference between oral antibiotics at home and intensive care. Prevention is powerful. The most effective step is vaccination. Pneumococcal vaccine for adults over 65 has demonstrated significant ability to reduce pneumonia hospitalization risk. Influenza vaccination matters equally because flu virus damages airway tissue, creating ideal conditions for secondary bacterial pneumonia, which carries far higher mortality than flu alone. Older adults should receive their annual flu shot every autumn without exception. Elderly pneumonia is caught by families, not by the person who has it. Older adults often do not recognize their symptoms, minimize them, or stay silent to avoid worrying their children. You are the early warning system. The 5 signs you learned today are the tools you need to act before a cold becomes a crisis. If this video helped you, please like, subscribe, And share it with every adult child and caregiver you know. Leave a comment below with any questions about protecting the seniors in your life. The next video has more essential health information waiting for you. Thank you for watching, and please take care of your family.